This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, December 9th, and I'm Zach Caruso. Our lead story this week is in the Substance Use and Addiction Journal and is titled Expanding Access to Buprenorphine and Methadone, Global Perspectives and Policy Recommendations. This is a narrative review of methadone and buprenorphine regulations, prescriber eligibility, dispensing models, and coverage across 8 countries: the United States, Canada, the United Kingdom, Russia, France, Iran, Australia, and Portugal. The study identified several key barriers to MOUD: requirements for daily supervised dosing, restricted community prescribing, and stigmatizing drug scheduling. The authors highlight policies that improved MOUD access without compromising safety, such as 1. Community pharmacy dispensing supports in the UK and Australia, 2. Liberal buprenorphine prescribing in primary care in France, and 3. Decriminalization and expansion of low-threshold public health models in Portugal and Iran. Next is an article in the Journal of Substance Use and Addiction Treatment titled The Impact of the Communities That Heal Intervention on the Provision of Jail-Based Medication for Opioid Use Disorder and Linkage Programs at Release, Results from a Randomized Waitlist Controlled Trial. This is a randomized waitlist controlled trial of the Communities That Heal, or CTH, intervention, which sought to expand MOUD within jails and linkage to MOUD upon release. A total of 34 communities were randomized to the CTH intervention group and 33 to the waitlist control group. The CTH intervention included an integrated set of community coalition-selected evidence-based practices. The study monitored jails' provision of MOUD via surveys of jail administrators. More of the waitlist-controlled jails provided MOUD at baseline. During the evaluation period, CTH jails increased MOUD induction from 63% to 71%. Although there was no statistically significant effect of the CTH intervention on MOUD induction or linkage, community coalitions were thought to play an important role in MOUD linkage and initiation. Our next article is in BMJ Open Quality and is titled Reducing Drug-Related Harm by Triggering Proactive Outreach. Scotland has the highest drug death rate in Europe. For this study, researchers used a trigger checklist, or TC, followed by assertive outreach between January and September 2023 in a rural Scottish community of 21,000. The TC consisted of 2 questions establishing drug/alcohol use and 10 questions about high-risk behavior. The TC could be completed by anyone concerned about a person's drug use, such as a hospital, the police, family members, or loved ones. The assertive outreach consisted of a pair of support workers visiting the person's home and offering harm reduction and treatment services. A total of 48 TCs were received, and all had assertive outreach within 48 hours. The median number of days between non-fatal overdoses was 6.5 prior to this project, and 23 at the end. There were no drug-related deaths during the project. This proactive approach can reduce drug-related harm. Next is an article in Academic Emergency Medicine and is titled Drug Use After Emergency Department-Initiated Injectable Buprenorphine, a Secondary Analysis of the ED Innovation Ancillary Safety and Feasibility Trial. While opioid overdose deaths have decreased, OUD remains a significant public health concern, and emergency departments, or ED, are vital potential points of intervention. Researchers evaluated short-term outcomes after initiation of extended-release buprenorphine in EDs between 2020 and 2023, assessing substance use in the first week after initiation. Among those who received extended-release buprenorphine, 63% reported no opioid use in the initial 7 days after the ED visit. In addition, by self-report, there was a significant decrease in use of multiple substances, including cocaine, benzodiazepines, methamphetamines, and cannabinoids. These findings continue to highlight the importance of initiation of medications for OUD in the ED. Next is an article in JAMA Psychiatry titled Structural Drivers of the Drop in Opioid Overdose Deaths in the U.S. Annual opioid overdose deaths have dropped an unprecedented 41% since peaking at 85,000 in June 2023. 2 factors drive overdose trends: the size of the at-risk population and its mortality rate. This study used the author's peer-reviewed model of the U.S. opioid crisis, SOURCE, to demonstrate how a falling at-risk population combined with probable plateauing of the mortality rate produced the recent decline in U.S. overdose deaths. Reductions to life-saving services may not increase deaths, but instead slow the decline, making harm harder to detect. Our final article is in the Journal of the American Medical Association and is titled Therapeutic Use of Cannabis and Cannabinoids, a Review. Approximately 27% of adults in the U.S. and Canada report having ever used cannabis for medical purposes. An estimated 10.5% of the U.S. population reports using CBD, a chemical compound extracted from cannabis that does not have psychoactive effects, for therapeutic purposes. Evidence is insufficient for the use of cannabis or cannabinoids for most medical indications. Clear guidance from clinicians is essential to support safe, evidence-based decision-making. Clinicians should weigh benefits against risks when engaging patients in informed discussions about cannabis or cannabinoid use. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.